We asked donors to come out and donate to make sure that our red supply was in good shape, and they responded tremendously.
The race to find a solution for COVID-19 is underway, and doctors and hospitals across the country are actively researching ways to do that. WCPO 9 News reporter Whitney Miller spoke with doctors who say plasma could be the answer.
We're talking about convalescent plasma. It's the plasma taken from patients who fought and won against COVID-19. Today, the Hoxworth Blood Center took its first sample of that plasma that could be used as early as next week. At the Hoxworth Blood Center at the University of Cincinnati, donors and staff are taking precautions to slow the spread of the coronavirus.
It's impossible to put a needle in somebody's arm and keep 6 feet away, but we're trying to do everything we can to make things as safe as possible.
Donations are by appointment only, and everyone is wearing masks. But it's not just blood being collected. Hoxworth is now helping local hospitals treat the virus with a special kind of plasma donation.
Convalescent plasma is plasma from people who have recovered from an active infection.
If you had documented COVID-19, you have the opportunity to save somebody else's life.
Dr. Dean Kereiakes with Christ Hospital is helping to administer this FDA-approved protocol.
Taking somebody's antibodies that they developed because they survived the infection and transferring that immunity or infection fighting capability to somebody who is failing, somebody who looks like they're losing the battle.
The effectiveness of transfusing convalescent plasma to fight COVID-19 has not yet been proven, but the concept isn't new.
It's been around since 1917-18 flu, the H1N1 flu, Ebola.
Dr. Fichtenbaum co-leads the innovation committee at the University of Cincinnati that's working to study how effective and safe this treatment is.
And we don't know whether the plasma that we give people will be safe in every single circumstance. So there is a possibility, though unknown, that if you gave someone plasma, that they might actually get worse.
Patients with COVID-19 are being identified for the study, but have the final say in whether or not they participate in the clinical trials. Being part of a large group of institutions it gives us a lot of ability to study whether or not, in fact, this is helpful, this is harmful in any way, or it really doesn't help at all. And as for the answer, only time will tell. Whitney Miller, WCPO 9 News.
But none of that works without you. If you have survived COVID-19, you're asked to contact the staff at Hoxworth. There's also a need for blood donors to call and schedule donations in the coming weeks.